Well, it's not moisturizer, it's not makeup, and not even a facial. There are two things just about every one of us can do to keep their skin looking young and healthy. Dr. Elma Baron is a dermatologist at UH Case Medical Center, and she's here to show us how to slow the signs down of aging. Thank you for being with us
It's
today.
fun to be here. Thank you.
So we've been saying that it's not expensive lotions. It's not any one of us can feel like we cannot do. We can do this.
Yeah. Actually, these are very simple things.
Sure.
One is protecting against sun exposure. I mean, don't get me wrong. I love sunshine. But there are things we can do to prevent sun from damaging our skin.
So you say sunscreen is number one.
Yeah,
that can help us
number one. Yeah.
Reverse, kind of help with the signs of aging.
Or prevent them from occurring in the first place. I mean, we know the skin cancer story already.
Sure.
But the other thing that we'd like to emphasize is that premature wrinkling, all those changes in our collagen, can also be prevented by the use of sunscreen. And I think a recent study has shown that very nicely.
Well, how about for those of us who used to love the sun when we were younger? We didn't really quite know back then how bad it was for you. Are there things that you can do to kind of reverse any of the damage that was done, or not so much?
Well, actually, that study that I was mentioning showed that even in middle age, it still makes a difference, because they followed middle-aged women for about 4.5 years, and the regular sunscreen users showed less wrinkling than those who only use sunscreens intermittently.
While we're talking about sunscreen, kind of break down sunscreen. We see, you go to any drugstore and you see such a huge selection, and now these keywords are like broad spectrum. Are those the words that we're looking for?
Yes, because, you know, the ultraviolet light is composed of different rays. We don't have to worry about UVC, but we do worry about both UVA and UVB. And so the sunscreen has to have protection against both spectra, not just UVB.
UVA and UVB.
Yes,
and then how about numbers? Because we see them go super high. Do we need all those, the high numbers?
Well, you need at least a minimum. I say that for daily use, probably an SPF of 15 is fine. 15, okay. But for recreational use, or if you're really out there, you're driving a lot, or you're outdoors a lot because of your job or because of your recreational habits, it should be at least a 30 or higher.
And every day, even though we live in Cleveland, they say we should still put sunscreen on our faces, even in the winter time. Right,
because winter time is still, you know, the ultraviolet light is still prevalent, even though it's gray and cloudy. The clouds only filter a certain percentage of UV, unfortunately. So you're not totally protected. So even when you're skiing, you should be wearing sunscreen.
Sure. Yeah. Okay, so we know that sunscreen is number one, and another very close second is what else? And this is very simple too, also starts with an S.
I know. Well, recently we discovered that adequate sleep is really important to prevent premature aging. And that's very interesting. I think all of us can use more sleep. I know there are certain circumstances that prevent us from getting a good 7 hours. I'm married to a wonderful sleep specialist, and he says 7 hours is what you need. I can never get 7 hours. But, you know, that's really what we found in our study, in that those who get 5 hours or less, they demonstrated more signs of skin aging than those who would get like 7 to 9 hours of sleep.
I thought it was interesting too when we were talking that you said people who sleep more actually heal better from the sun. So if you get a sunburn, those who sleep longer actually heal better with it.
Right, and you do want
Amazing how that is connected.
Right, and I would like to do more studies to really find out what's going on there, but we have seen already that if you are a poor sleeper, you cannot recover as quickly from a sunburn as a good sleeper.
No kidding.
And you don't want a sunburn to linger, because that's bad news. That's where the skin cancer and skin aging begins.
Real quick before we let you go, if you do get sunburn, what is the best thing for you that you should put on?
There are so many things that we can use to try to calm down the inflammation of the skin, but really prevention is key, because once you get the sunburn, the damage has been done, unfortunately.
All right. Sunscreen and sleep. So easy.
Okay.
Thanks for being with us today. We're going to try really hard. All right, thank you. It is now almost 8:30, 27 minutes after the hour. We are talking